Cancer nurse specialist is an advocate for patients through different stages of their treatment. We'd normally get involved at the diagnosis stage to begin with, part of the 2-week wait pathway, and I will see them in clinic and see how well they are and assess their symptoms.
When patients are diagnosed with cancer, we have a team of specialists, which could include the consultant surgeon, the oncologist, the pathologist, just to mention a few. These are all professionals who know a whole lot about the fields they specialize in. And we are also present in that meeting of professionals, trying to bring in the patient's needs, trying to be the advocate of the patient, so that even though we are looking at these cases as clinicians, we also try to understand the respective wishes of the patient. The cancer patient has various needs that we need to help them with at the point of diagnosis, and one of those things needs is psychological support, emotional support, information.
You don't hear anything after you get told you have cancer. So everybody else, my husband was taking in the information and being sort of the strong one and like asking the questions, and I was just sort of, oh my God, I'm gonna die.
Patients will process their diagnosis all very differently, and it's just kind of engaging in them and taking them at the time that they want to talk at, because some patients will be really despondent to begin with, then open up later on. Some will be open up to begin with, some won't open up at all, but it's just engaging them in the correct way that actually suits them and works for them.
The cancer nurses were amazing. That was one of the most amazing services that was provided here. They talked you through every single little thing. So between cancer diagnosis and actually coming in for chemotherapy, you have conversations on the phone, you come in to actually see them, and they just make you feel so at ease. Well, they made me feel at ease. You have the anxiety, but they explained everything. So it's absolutely invaluable.
Because I know my patients so well, they get to know me and I get to know them, and I feel comfortable that I can ask them questions. For example, would you like me to refer you to the dietitian? Would you like me to refer you to clinical psychology? Even prehab and rehab that we do here at the hospital, if I feel as though they might benefit from that as well, I would also ask if they want to participate in that. We don't just support the patients, we also support their families or their next of kin as well in that process. The most satisfying thing for me is when I see a patient in clinic and they say to me, "Oh, hi Cheryl," and I'm like, "Oh, you're seeing me in clinic," or "You're seeing one of the consultants," and I feel as though I've got a rapport with them and they've got to know me and I've got to know them. That's the most satisfying thing for me.
I have seen firsthand the impact of having that person that patients can rely on, someone they can just talk to, someone that doesn't just consider that diagnosis, someone that consider there are other aspects of their lives that matter to them. It's really satisfying, I must say. So I think that's why I do it. Having that joy of making an impact in helping someone at a time when it is really difficult for them.